Hello viewers, good evening and I welcome you all on behalf of Indian Medical College to this online class. So in today's session, we have a great energetic speaker and a beloved Dr. Girija Sivakumar Madam, who is a professor and head of the Department of Anatomy from Karpaga Vinayaga Institute of Medical Science with us. Madam is having 23 years of teaching experience in her field and also a coordinator medical education unit. She is a FAMA fellowship and also a resource person in a bioethics and a president association of anatomists Tamil Nadu. She has 25 publications, both national as well as the international, and also presented her papers and given guest lecture in various countries like United States, Japan, Myanmar, and Mauritius. Madam will be taking today the class posterior triangle and suboccipital triangle. Good evening and I welcome you, ma'am. It is an immense pleasure to have you here with us today.
Yeah, thank you, Dr. Kavya.
Thank you, madam.
Uh,
So, dear viewers, if you have any doubts or any clarification, you can just type them in the comment section below, and the doctor will clarify all your queries at the end of the session. Madam, I request you to please start the presentation.
yeah,
Thank you.
good evening, students. In continuation of exam preparation for first year MBBS students in anatomy, we have started this exam session, means like exam preparation session, where we are doing some series of classes in it. So these series of lectures will be not like a full lecture of 1 hour time, but it will be only some catchy points, what you need to present when you are writing it on your answer paper. And we are choosing the topics which are of university examination importance. And based on that, the past 10 years question papers, we are doing the topics. And in previous classes, we did with parotid and the submandibular gland. And now, today's class, we are doing with the triangles of neck. With this small introduction, we just move on to the triangles of neck. The triangles of neck, actually, it consists of three: anterior triangle, posterior triangle, and suboccipital triangle. All these three triangles are of examination importance, where each triangle will be asked as an essay question. And also, the small part of each triangle, they may come as a short note or short answer questions also. So based on that, what all we need to present on the answer paper, and what are all the points to be there, to be insisted, and how the diagrams are to be drawn on the paper. We'll just go on with it. Any triangle, if it is an essay question, just make a synopsis like this: an introduction, boundaries, subdivisions if there is any, the contents of each triangle, and a note on its applied aspect. So these are all the subheadings we need to insist on, under which we will be writing the many anatomical points in it. First, before we go into the triangles, let me just give 1 minute time. Those who are viewing the session, who is this person and what is the clinical case related to this person? I'll just take 1 minute time. I'll see to the chat box if anyone is answering. Madam, can we wait for 1 minute? No?
Yes, madam.
Here I'm not able to see the chat box.
The live chat is streaming, madam. Students are like typing. Still get any answers.
So that's what that chat box I'm not able to see. Is it right?
Yeah, it is viewable, madam. I'll just let you know if students type anything.
Yeah, I could see the share button, the save button, and the report, and thumbs up and down. These are the things I could see in my
Live chat is
screen.
still there, madam.
That's what I don't see to it. Anyway, you just look into the
Sure,
chat
sure, madam.
and let me know.
Sure, 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 madam.
Yeah, fine. If any answer is there, please let me know.
Yes, ma'am.
Shall we go ahead, ma'am?
Yes, madam. We can proceed with further.
Yeah, fine. See, uh, this person on the screen is Philip Hughes, and the clinical case involved in it is he met with an accident while he was playing, and he had a sudden hit on his neck region, and he was rushed to hospital. He was given all the treatment, but still in a week's time he he died. And then they detected that it was an injury to a major artery in the neck region, and that it led to the subarachnoid hemorrhage, and in turn he underwent coma, and subsequently he died. So based on this clinical means the person's history, we are going on with the suboccipital triangle and its clinical importance. Here is a case. A teenage boy of 18 years old was rushed into casualty as he fainted while he was playing cricket. On history taking, it was noted that he had a hit by a ball at the back of neck. He was immediately admitted to the hospital and was given a treatment with first aid procedures and the appropriate medicines. He was back to normal after 30 minutes of the procedure. In the first case, the person met with the accident, the same type of accident, but he finally died. But in this case, this boy was able to be recovered from the condition. So now, with the anatomy knowledge, we have to answer to this case. And as I said in my previous sessions, the question pattern it differs from university to another university. Some universities they give a case like this. In some university they give a question directly. So there will be a direct question also, a case-based question also. And whatever the question pattern it may be, what we need to answer for a suboccipital triangle is, and this is a case-based one where you will have a question, name the structure involved in this case and describe the triangle under different headings like the boundaries, contents, and its applied anatomy. So with this, we move on to the subheadings, what we have seen in the first slide. For every triangle, we have to say about introduction, boundaries, contents, and applied aspect. And coming to the suboccipital triangle, the suboccipital triangle is situated at the back of neck below the occipital region. It's bounded by suboccipital muscles and it accommodates some major neurovascular bundle related to cranial cavity. And this suboccipital triangle has got some boundaries like roof, a floor, medial boundary, superolateral boundary, and infralateral boundary. The contents of sorry, the boundaries, they are formed by, the roof is by the skin, suboccipital venous plexus, greater occipital nerve. The floor is formed by the posterior arch of atlas and atlanto-occipital membrane. Medially, it is bounded by rectus capitis posterior major and rectus capitis posterior minor. Superolaterally by obliquous superior and inferiorly by obliquous inferior. And this forms the suboccipital triangle. Coming on to the contents of the triangle, the suboccipital triangle, it consists of a set of structures like the suboccipital nerve, third part of vertebral artery, occipital artery, suboccipital venous plexus, which forms the roof of the triangle. On the roof, which is formed by the skin and the other structures, The suboccipital venous plexus will form a network over the roof, and they'll also form under the contents of the suboccipital triangle. And every content, we need to give some 1 or 2 lines about the description of the particular structure. For an essay writing, we need to talk about every content, just about 2 or 3 words of its anatomical importance. So the suboccipital nerve is the first cervical nerve, dorsal rami, and it is muscular in nature, which is supplying the suboccipital muscles. That means each cranial nerve, each spinal nerve, it divides into a dorsal rami and a ventral rami. The ventral rami are motor in nature, the dorsal rami are sensory in nature. Against this rule, the suboccipital nerve, which is the dorsal rami of C1, it's a muscular one supplying the suboccipital muscles against the rule. This suboccipital nerve, it emerges out from the first spinal foramen, and it ramifies over the muscles. It emerges out from the triangle, and it ramifies over the muscles of the suboccipital region that forms the boundary for the triangle and supplies these muscles. So here is the picture which you can practice drawing this picture, which has got the rectus capitis minor and major is a left suboccipital triangle where the boundaries you can see, and you can see to the first suboccipital nerve that emerging out from the through the first intervertebral foramen, and that it is ramifying over all the muscles to supply the muscles. Then third part of vertebral artery. The vertebral artery is a branch of subclavian artery. It has got 4 parts. The first part is the cervical part running across the neck. Second part is the vertebral part that passes through the foramen transversarium. Third part is the suboccipital part that runs in the suboccipital triangle. And the fourth part, it enters into the foramen magnum, through the foramen magnum, and it enters the cranium, which becomes the intracranial part, that is the fourth part of the vertebral artery. So this third part of the vertebral artery, it runs in the suboccipital triangle. And the occipital artery is another one structure which is running along the superolateral boundary of the triangle, and it goes to supply the scalp. Here is the suboccipital venous plexus. You can just draw an outline of the skull, and you can draw some blue colored venous structure over the suboccipital triangle. First you draw the boundaries, then you can draw some venous plexus, and you can label it as suboccipital venous plexus. These suboccipital venous plexus, they form a network of veins over the roof of the triangle, and it connects the veins that provides an alternate route for the venous channel during any venous block. The veins that are connected by the suboccipital venous plexus, if you see, they are the muscular veins coming out from the suboccipital muscles, vertebral venous plexus that are draining the vertebral column and the spinal cord, the deep cervical veins that drains the neck region, emissary veins that are connecting the intracranial and the extracranial veins, and exclusively the venous plexus formed around the vertebral artery. So these are the set of veins that are connected by the suboccipital venous plexus. So whenever there is a venous thrombosis, this venous plexus, it gives an alternate channel for the blood route, the venous blood route. So these few points you can write under the suboccipital venous plexus. Coming on to the applied aspect, the connection between the suboccipital venous plexus, it serves as an alternate venous channel during any intracranial infections or the carbuncles. The carbuncles are nothing but a small cyst formed under the hair follicle in the suboccipital region. Any infectious condition in the hair follicle, these carbuncles are formed in a small cyst-like form. And that during this infections, the venous blood will take an alternate route to enter into his destined vein, major vein, through these suboccipital venous plexus. So these two lines you can just write for the applied aspect. The second one is the tortuous course of the third part of vertebral artery, which is present in the suboccipital triangle. It will try to damp down the intracranial arterial pulsation if there is any block in the cranial arteries. And that if there is any block in this vertebral artery, this third part especially, it will lead to fainting or unconsciousness. The major importance of the vertebral artery is the two vertebral arteries on either side, they join together to form basilar artery. So this vertebral artery and the basilar artery, they're all connected to one another so that they will give a collateral circulation. And whenever there is an intracranial pressure increase or the arterial pulsation increases, this vertebral artery, it gives some relaxation for the intracranial arterial pressure, so that there will be a damping down of this intracranial arterial pulsation. And again, in turn, if this vertebral artery also is getting blocked, that leads to fainting or the unconsciousness of the patient. So this another point you can write about the vertebral artery. And again, the cisterna puncture is done by inserting the needle deep to atlanto-occipital membrane above the spine of axis. This is another clinical importance where the lumbar puncture was not able to perform. The cisterna puncture is preferred for draining the CSF fluid. That is the applied aspect. So on a whole, when you are writing the suboccipital triangle, you need to write about the introduction, boundaries, contents, few lines about each content. You can write down this, draw down this diagram, and this diagram you can draw for the boundaries. And about each structure, just write about some few points about them. And these are all the important clinical aspect what we can write about the suboccipital triangle. So this is the suboccipital triangle. How you have to write about the go with the essay writing. Supposing if the same question it is asked in a 5 mark or 4 mark question, how you should concise. When you write the entire thing, it becomes an essay. So in a 4 mark or a 3 mark, what they will ask you is, they'll ask you about just the contents of the suboccipital, mention the contents of the suboccipital triangle. In that case, what you can do is, you can just draw this diagram. Just you can write in 2 lines. It has got the following boundaries: medially, superolaterally, and supromedially. Like that, you can just write one line you can write, and write in extensive way about all the 4 structures. And when you are writing these 4 structures, you can just write 1 or 2 lines about these 4 structures. Your diagram is most important. This suboccipital nerve, how it emerges out of the triangle, and how it ramifies over the muscles of the suboccipital triangle, how it becomes or how it supplies the muscles of the suboccipital triangle. And the roof of the triangle is crossed by the greater occipital nerve. So all these things you can draw and describe with the contents. And when you write the applied aspect, just a line you can mention. You don't need to describe in detail like this and all in an applied point. Just 1 or 2 points is enough when you're writing for a 5 mark or a 4 mark question. Okay. So that's about the suboccipital triangle. So any questions if you have, you can just post on the chat box. Then we will move on to the next triangle. Ma'am, we'll give them 2 minutes time, ma'am.
Yes, madam. Yes, ma'am.
Yeah, fine.
Madam, we shall just proceed. In case of any doubts or clarification, I'll just let you know, madam.
Yeah, yeah, sure. Yeah,
Okay.
fine. So moving on to the next triangle, it is the posterior triangle. This is another subdivision of the side of neck. The neck region, it has got the entire neck region on either side. It has got some triangles, and that on the side of neck, which is divided into two major triangles, is the posterior and the anterior triangle. And today we are going to see to the posterior triangle. So before we go into the topic, here is a case. A 65-year-old woman visited her family physician with a swelling in her neck in the region of left posterior triangle. On examination, it felt very hard and the physician thought it may be an enlarged lymph node. The patient was then referred for FNAC. Following the procedure, the patient complained that she was not able to elevate her left shoulder above 90 degrees to comb her hair. On examination, it was found that her left trapezius was paralyzed while left sternomastoid was normal, and he concluded that the spinal accessory nerve might have been excised inadvertently during biopsy. So, when you see to this case, why this happens and why very frequently the spinal accessory it gets trapped during the biopsy in the neck region. So, with this case, identify the structure damaged in the procedure and describe the posterior triangle, its boundaries, contents, and applied aspect. So if it is a case-based question, you will have a question like this. If it is a direct question, the second part alone will be the question. Describe the posterior triangle, its boundaries, contents, and applied anatomy. So now again, with the posterior triangle, the introduction. The side of neck is divided into two large triangles by a muscle called sternomastoid. In front of sternomastoid, it is the anterior triangle. Behind the muscle, it is the posterior triangle. The major content of this triangle, that is the posterior triangle, are a number of nerves derived from cervical plexus and a cranial nerve. With this introduction, we can just draw the diagram where you can show the boundaries or the position of the posterior triangle. Is the sternomastoid. In front of sternomastoid, it is the anterior triangle. Behind the sternomastoid, it is the posterior triangle. Now coming on to the boundaries. The posterior triangle, it has got a roof, a floor, anterior boundary, a posterior boundary, an apex and a base. So here, the posterior triangle, the apex, base, anterior boundary, posterior boundary, roof will be there, and floor. The posterior triangle, the roof is formed by the skin, superficial fascia, platysma, investing layer of deep cervical fascia, external and posterior jugular veins, cutaneous nerves and veins that pierces the roof. And we said all these are derived from the cervical plexus. So the roof, you can list out these structures. The floor is formed by a set of muscles. From above downwards, we have the semispinalis capitis, splenius capitis, levator scapulae, and scalenus medius. These are the floor muscles that forms the boundary. This is the floor of the posterior triangle. Here is the roof, which is formed by the investing layer of deep cervical fascia. And you can see it is pierced by a number of structures emerging out from the posterior triangle. From the posterior triangle, there are some cutaneous nerves, which are all the contents of the triangle. They pierce this investing layer and they ramify over different directions. and they go to supply various structures. So there is one point like the structures piercing the roof of the posterior triangle. So you can list out like lesser occipital nerve, great auricular nerve, transverse cervical nerve, supraclavicular nerve, external jugular vein. These are all the structures that are piercing the roof. Okay. So in a short note or in a 2-mark question, you may be asked to write, name the structures piercing the roof of the posterior triangle, or name the structure forming the roof of the posterior triangle, or which part of the deep fascia will form the roof of the posterior triangle, roof and the floor. The roof is formed by the investing layer, which is pierced by these list of structures which are emerging out from the posterior triangle, from the midpoint of the posterior sternocleidomastoid. So we can list out here the lesser occipital nerve, great auricular nerve, transverse cervical nerve, external jugular vein, supraclavicular nerves. It is the roof structures. When you see the muscles forming the floor of the posterior triangle, the floor is formed by, from above downwards, semispinalis capitis, splenius capitis, levator scapulae, and scalenus medius. The scalenus anterior will go down and the scalenus medius will form the floor of the triangle. The posterior will be seen behind the scalenus medius. So the floor of the posterior triangle, it is formed by semispinalis capitis, splenius capitis, levator scapulae, scalenus medius. And the boundary of the triangle, if you see, the anterior boundary is formed by the posterior border of sternocleidomastoid. The posterior boundary is formed by the anterior border of trapezius. The apex is formed by the meeting point of these two muscles. The base is formed by the middle third of clavicle. Okay. So these are all the roof and the floor of the triangle. So this is the floor. The floor muscles are covered by the another layer of deep fascia, that is the prevertebral fascia. The deep fascia of the neck, it is made up of 3 parts, or it is divided into 3 parts: investing layer, prevertebral layer, and pretracheal layer. The investing layer will form the roof of the triangle. The prevertebral layer will form the floor of the triangle. So on a whole, the roof is formed by the skin, platysma, superficial fascia, the deep fascia, investing layer of deep cervical fascia, and the cutaneous nerves that are piercing the investing layer of deep cervical fascia. In other words, the roof of the posterior triangle. The floor is formed by these set of muscles which are covered by the prevertebral fascia. The entire triangle has got an apex, a base, an anterior boundary, and a posterior boundary. Apex is by the meeting point of the trapezius and the sternomastoid. Anteriorly, it is bounded by the posterior border of sternomastoid. Posteriorly, by the anterior border of trapezius. The base is formed by the middle third of the clavicle. So here you can write it as posteriorly by the anterior border of trapezius, anteriorly by the posterior border of sternomastoid, and below the base is by the middle third of clavicle. The entire posterior triangle is subdivided into an upper occipital triangle and a lower subclavian triangle by an inferior belly of omohyoid. Here you can see, this is the inferior belly of omohyoid, which divides the entire triangle into an upper occipital triangle and a lower subclavian triangle. So you can write it as the posterior triangle has got an apex, a base, anterior boundary, posterior boundary, roof, floor, and two subdivisions, upper occipital triangle and a lower subclavian triangle. So the boundaries we have seen, the omohyoid is dividing the entire posterior triangle into an upper occipital and a lower subclavian. The upper occipital, it is bounded by, again it has got some boundary. It's by the posterior border of sternomastoid, anterior border of trapezius and omohyoid forming the base. And apex is formed by the meeting point of trapezius and sternomastoid. When you see it is a subclavian triangle, the base is present above, the apex is present below. That means the lower subclavian triangle, it has got a boundary above, anterior and posterior. That is postero-inferior. So superiorly it is bounded by omohyoid, anteriorly it is bounded by sternomastoid, posteriorly or postero-inferiorly by the middle third of clavicle. This is the boundary for the subclavian triangle. So you can just subdivide the triangle with this omohyoid. You can practice this diagram. And for each triangle, you can write the boundary as like this. For the occipital triangle, the apex is above, the base is below. For the subclavian triangle, the base is above and the apex is below. Okay. So that's the subdivisions of the posterior triangle. Coming on to the contents of the suboccipital, sorry, the posterior triangle. Sorry, here is a mistake. It's a posterior triangle. It's by the lesser occipital nerve, great auricular nerve, transverse cervical nerve, supraclavicular nerves. We have the occipital artery, which runs in the uppermost part of the triangle, spinal accessory nerve, the dorsal scapular nerve, the cervical, transverse cervical artery, or these are all the contents of the posterior triangle. When you see to the contents, the lesser occipital, great auricular, transverse cervical, supraclavicular, all these four, they come from the cervical plexus. These are all the branches derived from the cervical plexus. So when you see to these nerves, they emerge out from the midpoint of the sternocleidomastoid and they will run in different directions. The lesser occipital, great auricular, transverse cervical, supraclavicular, and the nerve, the spinal accessory nerve, all these nerves, they will emerge out of the triangle deep to the sternomastoid at the posterior border, and they will ramify over different directions. It will look like the spokes of a wheel. So that's how it will be described in the textbooks and all. The contents, the cutaneous nerves which are lying in the posterior triangle, they emerge out of the triangle at the midpoint on the sternomastoid, on the posterior border of the sternomastoid, like a spokes of a wheel. That's what it will be given in the textbooks. So here these nerves, after emerging out, they will run over the various directions and they go for the supply. Mainly the lesser occipital, great auricular and all, they'll go for the sensory innervation to the scalp. The cutaneous innervation to the scalp. The transverse cervical, it goes to the neck region. The skin on the neck region. The supraclavicular, it goes to supply the skin over the clavicular region. And this spinal accessory, which comes out in the posterior triangle, it will divide into two branches. One will supply the sternomastoid, the other one will supply the trapezius. And the biopsy will be taken in the posterior triangle in any case of the suspected neck cancer. The biopsy will be taken in the posterior triangle, and that's why in the middle point, mid region, because here the external jugular vein will be there and the internal jugular will be running over in the anterior triangle. So there the internal jugular will be lined with the set of lymph nodes. So to take for the biopsy, they'll approach from the posterior triangle. And that's the reason why in most cases, the spinal accessory will get damaged, especially the branch that goes to the trapezius. That is because of the position of the spinal accessory nerve. So on a whole, to write in the contents of the posterior triangle, we can write about in the occipital triangle, these are all the contents: lesser occipital, great auricular, transverse cervical, supraclavicular, spinal accessory, dorsal scapular, the superficial transverse cervical, occipital artery. So when you want to write down about these structures, the four nerves together, you can write it as they are derived from, or they are the branches of the cervical plexus. They enter, they lie in the posterior triangle, and they leave the triangle at the midpoint on the posterior border of the sternomastoid, and they ramify in different directions like spokes of a wheel, and they supply the scalp. The supraclavicular nerves, it runs downwards and supplies the skin over the clavicular region. The transverse cervical will supply the skin over the neck region. The levator scapulae, the dorsal scapular nerve, it will run down and it will supply the levator scapulae, which is one of the floor muscle. The spinal accessory will run along the floor of the triangle, and it gives a muscular branch, one to the trapezius and one to the sternomastoid. Coming on to the subclavian triangle. Subclavian triangle, it consists of third part of subclavian artery, subclavian vein, the trunks of brachial plexus, the terminal part of the external jugular vein, which opens into the subclavian vein, suprascapular and dorsal scapular arteries, which are all coming out from the subclavian and the axillary arteries, and cervical lymph nodes. As the most important one, the cervical lymph nodes. So here, when we see into the picture, below the omohyoid, these are all the trunks of brachial plexus, the third part of subclavian artery, and deep medial to it, we have the subclavian vein. So these trunks of brachial plexus, and they are in turn will divide into some divisions, and those divisions are going to form the cords. So any injury in the subclavian triangle due to trauma, these trunks may get damaged so that they may lead to paralysis of some group of muscles, maybe the flexors or the extensor, depending on the trunk which is affected or injured. That is one of the clinical importance. And in the subclavian triangle, the subclavian artery is the major content in the triangle, and that's why the triangle itself is called as the subclavian triangle. So when you see to the applied aspect, so on a whole, about the posterior triangle, we need to talk about the location where it is present. We need to give a small introduction about the posterior triangle and where it is situated, and the boundaries of the triangle. So the boundaries, under the boundaries, we can write about the anterior, posterior, apex, base, roof, and floor. So each boundary, you can just write down 2 lines about it. What is the forming the anterior boundary? What is forming the posterior boundary? The apex is formed by what structure? And the base is formed by what structure? All these things we can write down under the boundaries heading. And subdivisions of the triangle, we can write about the omohyoid, the 2 bellies, in which the inferior belly, which separates the triangle into an upper occipital triangle and a lower subclavian triangle. So for each triangle, you can write about the boundary, and the floor, what is the structure forming the floor. That means what are the muscles forming the floor, and what are the contents of the triangle. And under the contents, you can write down separately the contents of the posterior triangle and the contents of the occipital triangle. The occipital triangle and the subclavian triangle. So in the occipital triangle, we have the the four cutaneous nerves derived from the cervical plexus, along with the spinal accessory and the dorsal scapular, superficial transverse cervical artery, and the occipital artery. And again, in the subclavian triangle, we have the third part of subclavian artery, subclavian vein, the brachial plexus, trunks of brachial plexus, the external jugular, which opens into the subclavian, suprascapular and the dorsal scapular, cervical lymph nodes. So after completing all these things with the proper diagram, all these diagrams are line diagrams only, which you can practice very well. And all these diagrams are available in your textbook itself. So the most important thing in writing an essay is to practice these diagrams. Once you practice all these diagrams, it will be very easy for you to write down the notes. And the occipital artery, it crosses the triangle in the uppermost apex part of the triangle. So when you see to the clinical aspect, the pus collected in the posterior triangle due to a tubercular cervical vertebrae, this pus collection will be seen deep to the investing layer of fascia, which forms the roof of the triangle. So what will happen? There are the venous structures present in the posterior triangle. Some veins are in the roof, some veins are in the deeper part. So this cervical tubercular vertebrae will spread on to the investing layer first, and then it will be tracked down into the deeper veins, and finally they will be tracked down into the axillary lymph nodes. So whenever there is an enlargement in the axillary region, it may be one of the symptoms of the deep cervical lymph node infections or with the mammary infections. So you have to rule out whether it is a mammary infection or the deep cervical lymph node infection, which is secondary due to the tubercular cervical vertebrae. So it's all depends on your history taking and how you diagnose, how you make a physical examination with the patient. So one important clinical aspect of the posterior triangle is a pus will be collected in the posterior triangle deep to the deep investing layer, means deep fascia, investing layer of the deep fascia, which is forming the roof of the triangle. So from here, it will spread on to the deep cervical lymph nodes and in turn into the axillary lymph nodes. And any injury in the subclavian triangle will lead to the injury of the brachial plexus at the trunk level, as I said earlier, and that it may lead to the paralysis of many flexors and extensors in the upper limb. And main clinical aspect is the damage to the spinal accessory, and which is frequently occurring in a biopsy of a neck tissue for ruling out for the neck carcinoma. So these are all the points you can write down for the clinical condition of the posterior triangle. So with this, we finish off two triangles, the suboccipital and the posterior. In our next session, we'll be doing the other triangle. So when you write down the posterior triangle for an essay, these are all the points we need to write. Again, this posterior triangle may be asked for your 4 mark or 2 mark also. In a 4 mark, they can ask you occipital triangle, either the occipital triangle or the subclavian triangle. So you can concise the points and you can write it down for a 4 mark. Or in a 2 mark, they may ask you to write down the contents of the posterior triangle, either, or contents of occipital triangle or contents of subclavian triangle. So in that case, you should know to concise how much you have to write and what you have to write. For any 2 mark question, you are not expected to write any sentence. Just you give the to the point. For example, in 2 mark, if they ask you to write, list out the contents of posterior triangle. Just you write one line, the contents, the structures present in the posterior triangle. Then you write down 1, 2, 3, 4, 5, 6, 7, 8. Like that, you list it out, you write down the names. That itself will do much for your 2 mark question, and that will fetch you the entire 2 mark. And in a 4 mark, you need to write a small list of these structures with 1 or 2 diagram maximum will be more than enough to fetch a full mark in a 4 mark or a 5 mark question. So with this, I finish off the posterior triangle and the suboccipital triangle. We may go for any questions.
Thank you, ma'am, for such an interactive session, and also it was a very informative session. We shall just wait for a few minutes to get the questions from the audience and the viewers.
Yes, ma'am.
So, madam, can you please stop sharing the slide?
Yeah.
I'll let you know whether if we get any live chat queries.
Yes.
Thank you so much, madam, for such a informative session. It was really wonderful. I hope the students have got benefited with the session.
Yeah.
And
Thank
it
you.
is
Thank
very
you.
interactive with the live chat also. We are getting nice comments.
Uh-huh.
And
I'm not able to see the chat over here. I don't know why.
I'll send you, madam. And students, I hope you have enjoyed the session. So kindly share our YouTube channel and our Facebook page. The links are given. And you can also access the recorded video, MCQs, and all the announcement of the sessions will be made at our Facebook page. If you have any doubts or any queries on today's session, you can just post it in the comment section, as the live chat won't be available after this video got end. So madam will help you in clearing all your doubts. So this is our upcoming session tomorrow. So this is schedule for tomorrow session. Session 1 is being taken by Dr. Tanushi Mondal, Calcutta Medical College. The topic low birth weight, and session 2 is being taken by Dr. DC Matanki from the Sri Ramchandra Medical College on the topic regulation of respiration. Thank you so much. Madam, we have
Yeah.
not received any queries, so
Okay.
thank you
Thank
so
you, ma'am.
much for
Thank
a
you.
wonderful session,
I'm
ma'am.
leaving the session.
Yes, ma'am. Thank you. Thank you, students. We'll see you all in the next session tomorrow.